even after, this is one of the most like dangerous things, is even after a person has died, the virus still lives in their body. So, even when, people in Africa, they have, culture, they have burial, traditions, so they're gonna, bury, the body, and they're not gonna understand that the virus is still inside of that body, and they're gonna get infected.
Some symptoms, they start to occur 2 to 21 days after exposure to the Ebola virus disease. And some symptoms we see are fever, severe headaches, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, and unexplained hemorrhage or bleeding or bruising.
So basically how it spreads is the virus gets into the cell, and it usually goes through the respiratory tract, the eyes, bodily cavities. So that's why most cases have problems, with vomiting and, eyes. They have, some people, are bleeding out of their eyes. It's really gnarly. So once the virus gets into the cell, the genetic contents are released, and then through mitosis they replicate, and then they send them back into the cell, just infecting your entire body, which makes it one of the reasons why it's so hard to actually cure.
Some cases in the U.S. of September 30th, 2014, says the first laboratory confirmed case of Ebola. There was a man traveling from Liberia to Dallas, Texas, and he died on October 8th, 2014, and that shows how it kind of got to the U.S. because they brought it from West Africa.
And Liberia is one of the places where it was most affected, so that was definitely dangerous. And then on October 10th, which is only 2 days after the man died, a nurse got, I think it was in the news, the nurse got, infected because she was treating him. And she was quarantined, but she actually recovered, so that was good.
And November 15th, 2014, Dr. Martin Salia died from the virus after treating patients again in West Africa.
Yeah, so he came back came back and died. Passed away.
Possible vaccines, there's the STRIVE Sierra Leone trial to introduce a vaccine against Ebola, and also CAD3-ZEBOV, which was created by the GlaxoSmithKline.
Yeah, there's some candidates. They're not exactly proven, but they are testing in, because at this point they want to make sure that Ebola does not make its way into a global outbreak in the United States.
It is very dangerous because, again, some West African countries, like the LDCs, they do have very strong rituals and beliefs, and when they bury their loved ones, they can get exposed to the disease.
There's definitely a lack of education, information, understanding in West African or just African countries, because they are LDCs, so they're gonna need to be taught by MDCs that they need to take procedures to protect themselves from the virus, or else it's just gonna keep spreading if they don't understand the consequences and how it spreads.
Some more global epidemics are the avian influences, which are transmitted from birds to humans, and some of those birds are poultry.
Cholera, which was an intestinal infection. It was also, popular, common in Africa, and it was caused by contaminated water.
Thank you. Any questions? Yes.
How long does the Ebola take to kick in and for them to start noticing that?
After you are exposed to the virus, it takes 2 to 21 days for you to get symptoms. So after 21 days, they're you're clean, you're fine.
Do you think we're serious in the United States?
I think that in the United States we have strong health systems, and it's definitely a possibility, but I think that it's never going to be as worse as it is in Africa, because
our medical technology is kind of greater than in the LDCs, so we can kind of control it better, but there are still some cases that are uncontrollable.
very good, girls. That was very good.